Hi, Dr. Yass here. I want to talk about the secondary effects of sustained and chronic pain, which so many people globally suffer with, specifically hopelessness, depression, and even feelings of suicide. Now, the medical establishment will have you believe that there is a correlation between pain and these experiences, and that both need to be addressed for your pain to be resolved. So not only do you have to establish the cause of your pain and resolve that cause, which is in fact the tissue in distress eliciting that pain, but somehow you have to address the idea of hopelessness and depression, that somehow the emotional connection needs to be addressed as well. That is the only way to resolve your pain. In fact, I had my book, The Pain Cure RX, was reviewed by the British Pain Society, and they discussed the fact that from a theoretical perspective, that the book is accurate in its presentation, that there is limited, in their words, limited connection between positive MRI findings as the cause of pain. But they went on to note that the book's name, The Pain Cure RX, could not be accurate in the sense that a cure cannot be achieved until the emotional attachment to pain is resolved. And I found this to be repulsive and illogical. And the best way to understand this is in this analogy. So if I was to pinch you today, just pinch you on your arm, I would imagine that you would not have a nervous breakdown simply because of the fact that I pinched you on the arm. And in fact, I do not believe that there is any neurological connection from the area of the brain that experiences pain to the area of the brain that creates emotional distress. But if you knew that over the next year I was going to come along and pinch you each hour of the day, 24 hours a day, 7 days a week for the year, I would imagine that that would begin to create anxiety, which would then lead to a sense of hopelessness or depression, or saying, hell, I just don't want to deal with this anymore. So what you actually can recognize is that it is not the pain that creates these symptoms, these emotional responses. It is the sense of not being able to resolve the pain that actually has created these feelings. And who is responsible for that? It is the medical establishment in their inability to properly diagnose the tissue in distress, because in more than 98% of cases, the cause is muscular, and MRI and X-rays cannot identify muscular causes. There is certainly nobody in the medical establishment trained or educated to identify these causes, which is the primary reason for chronic pain. I have said it forever. Look right behind me. What does it say? Misdiagnosis equals chronic pain. If you don't identify the proper tissue, then you cannot address the distress of that tissue, resolve the distress of that tissue, thereby having that tissue no longer have to emit the emergency signal, distress signal of pain. If it's not in distress, it doesn't have to elicit that symptom. So it is actually misdiagnosis that is leading to chronic pain, which is leading to this sense of hopelessness, depression, and even potential suicidal thoughts, with the sense of the idea that the person feels they just may not be able to wake up another day without having to deal with pain and its effect on their ability to work or have relationships or any of the other aspects that go with having a normal life. So let's be absolutely clear in our understanding. Pain and hopelessness, depression, and potential suicidal thoughts are not connected. They are not connected. One is the resultant of the inability to address the other properly. So For all those people who are being told, oh, this is all in their head and they have to somehow get some sort of psychological help to address the hopelessness and the depression and the other feelings before they can resolve their pain, this is just pure crap. Just meaningless nonsense. John Sarno at one point discussed the idea that there is somehow a connection, that in fact the pain you're experiencing is not physical, it is actually emotional, and it's a repression of some prior emotional distress that you had, and the only way to resolve the pain is to resolve the emotional distress. This is somewhat illogical because it seems strange that if you're having pain at your left knee, which would indicate that you're having some sort of emotional distress at that knee, what does it say about the right knee that you're not having pain? There you're joyful, so you can have emotional distress and joyfulness all at the same time. It's kind of doesn't make any sense. The pain is clearly physical. The reason that things like this perpetuate is simply because the medical system is incapable of establishing what tissue is in distress, thereby addressing the distress of that tissue so it can be resolved, thereby ending the need of that tissue to emit that symptom. That's the reality. So please, folks, recognize if you're having pain, you simply need to establish the tissue eliciting the pain, resolve the distress of that tissue, and your pain will be resolved. And you will be able to go on day after day going forward without the fear, the anxiety of waking up and recognizing, oh my God, it's like Groundhog's Day. Another day that I have to live with this pain. All right? This is important for you to understand. They are completely separate. Pain and emotional distress. Two separate things. One, emotional distress comes from the inability to address the pain. It is not the pain itself. There is no logical reasoning to think that that pain is somehow connected, that they actually are together and you need to address both to end your pain. Foolishness, nonsensical, illogical. All right, if you like this video, please give it a thumbs up. I hope you like this video. I hope you like all my videos. I hope they make sense to you. I realize it's coming from an opinion or a presentation that's completely opposite of anything you've experienced before or have gotten a chance to hear from the medical establishment. But that's the beauty of this. People are finally waking up and realizing that there is a true, logical alternative to the medical system. I'm getting contacted at such an increased level now, and it's exciting and it's humbling, because it's telling me that all the work I've done to create awareness of this alternative is paying off now when people are reaching out, even globally, which is the more exciting part, okay? So keep contacting me, giving me thumbs up on these videos. It helps for Google and YouTube. When you give those thumbs up, it helps them to want to put this in a higher level of suggestion for those who are searching for issues that relate to the things I talk about. If you do like my YouTube channel, Dr. Mitchell Yass, please subscribe. That way you get notifications when new videos are added or when I am live on YouTube. And if you have a question about your issue, you're not sure how to proceed, please contact me at drmitch at mitchellyass.com, drmitch at mitchellyass.com, Dr. Mitch at mitchellyass.com. If you'd like to set up a Skype or Zoom session so that I can assist you and guide you to establishing what tissue is in distress. And the good news is, in more than 98% of cases, it is muscular. So all it takes is an understanding of how to determine which muscles are creating the symptoms, how to perform the proper exercises, and how to use progressive resistance to get those muscles stronger so that your force output is greater than the force requirement of your activities, and you are pain-free and fully functional, and that will end that sense of hopelessness, depression, and any other distressful feelings you may have. All right? Let's keep moving forward. Let's keep helping each other. Let's spread the gospel of the YASS method. For now, this is Dr. Mitchell Yass wishing you a pain-free, fully functional life. Bye-bye for now.